It is under scrutiny, and I'm talking to Dr. Baluku in the last segment of a series of a very, very interesting and engaging, should I say intriguing, conversation with a lovely doctor. It is clear that if God can keep him away from politics, his career in international medicine is just about blossoming, and that's why he's chuckling. Now, you have seen bottles and probably heard adverts that are saying excessive alcohol may be harmful to your health. Are those adverts telling us the real truth, doctor?
Yes.
Are those adverts saying the whole truth, or are they intentionally obscuring medical truth?
Let's start with the medical truth. Is how harmful is alcohol actually?
Any alcohol?
Yes, any alcohol. I'll tell you that the death rate in people who drink is estimated to be between 2 to 4 times higher in alcohol, in people who drink, than the normal population if you're a woman. If you're a man, it's 3 to 7 times higher, the death rate.
So the moment I pick alcohol, and I'm a woman, I have increased my death rate by over...
Yes, between 2 to 4 times.
If I had a chance to die by drinking, I have doubled it.
Exactly.
Okay. If I am a man, I have tripled.
Between 3 to 7 times. In fact, the life expectancy of people who drink is reduced significantly by about 10 to 12 years. How harmful is alcohol? It's that harmful. Up to about between 33 to 50% of road traffic accidents, a drunk person is implicated.
Up to?
Between 33 to 50%.
Of road accidents?
Road accidents.
In Uganda?
Generally, when you look at the global figures, yes.
Alcohol is involved?
Yes.
But we still drink?
We still drink. Think about suicides. 22%, global researchers demonstrated 22% of suicides actually are associated to alcohol. How harmful is harmful?
We are not even talking about marital breakdowns and the social problems. Here we are still doing with
the health.
With health.
Even the social problems. For one drinker, there are 4 people who are affected by their drinking.
One. Social.
Just for one drinker. So how harmful is how harmful do we want it to get?
No, the advert says excessive.
Yes. And I've already told you the cancers that probably put you at risk. You know. So I think that when you say excessive consumption of alcohol may be dangerous, may be harmful to your health.
First of all, excessive.
So there are 2 things that I question. When you say maybe. Maybe you're saying we are not yet sure. We are still establishing if it is harmful. It is probability. And when you say excessive, how excessive is excessive?
Do you think the government should inform Ugandans that all alcohol is harmful? Is that what the advert should be? So that those who choose at least choose.
I think if the government is actually bent towards stopping the consumption of alcohol and is concerned about the health of the Ugandans, it should do what it is doing with cigarette smoking. And you say alcohol consumption will kill you because it will kill you in accidents, it will kill you in rectal cancer, it will kill you now. And I think that's where we should be going to give such strong messages. But look at us. When you watch a television and there's this alcohol advert, they are still as sensational as they used to be. They show you highly functioning people who are achieving things, progressing in careers, who are drinking, and they say, come and we celebrate at the end of the day our achievement. Isn't that what they say?
That's what they say.
Yes. And no, you listen to radio and say this one doesn't give you a hangover. It leaves a nice perfume in your mouth, in your breath. I think that these are misleading adverts, and the government should probably become more strict when it comes to that.
But they pay for the airtime.
Of course, restricting the consumption of alcohol has an impact on trade and revenue. Yes, it does, and employment, of course. But what's the benefit? Would we have dead employed people? I don't know. I would think that would weigh the benefit.
Yeah, but some scriptures have indicated that a little bit is good for people's stomachs. Is that medically proven?
I'm sure you're asking the wrong authority. I may not speak on behalf of the Bible or a spiritual book, but how little is little? Because when you understand the phenomenon of alcohol and also on other drugs, there's something called tolerance. Once you sip 1 bottle today of beer, you may feel aroused. When you continue sipping 1 bottle, you no longer feel as aroused. What happens? You step up the dose. then you step up the dose. Before you know it, what was a little alcohol good for your stomach, it is a much alcohol bad for your stomach actually. Yes, so tolerance has an impact that taking minimal amounts of alcohol can actually worsen. In fact, some research has demonstrated that young students, it was this, especially college students, who consume energy drinks and alcohol at the same time, energy drinks and also use alcohol, are more likely to become dependent on alcohol. Yes. So how little is little? I may not answer that question. But you know, I wanted to interest you in this advert that says, where they say, not to sell for persons under 18. That itself is misleading. Are you saying to persons under 18 it is free? It should not be sold to them? You know? Messages must be clear. You can't say not to.
I didn't see that coming. You're saying not to be sold to persons under 18. Is that means that they should just be
given to them free?
Okay.
And of course, and even then, how do you enforce the under 18 in this country?
Okay.
It's probably not well being enforced.
Well, with of course, with a lot of corruption in this country, you can tell that for somebody who wants to make money, because we don't know any punitive measures that are going to be taken if somebody sells to a 16-year-old a beer bottle.
I'm sure the Constitution has something to say, but we do not have enforcement of these things, of these kind of cues that we are trying to give as messages.
So, where are we in terms of alcohol-related health repercussions?
Repercussions?
Yeah, I mean, you work in Mulago. As you do your treatment, give us a picture. How much has alcohol contributed to the cases that we are handling, for instance, in the emergency room?
Okay. Just like I was trying to explain to you, think of accident, for example. Over 50%, between 30 to 50%, you're sure that there was a drunk person or who was under the influence. We talked about suicide, for example. And as patients, especially those who have mental illness, they have a very high increased risk of depending on alcohol. Yes. And then think of cancers, for example, cancer of the liver. The highest percentage, a good percentage of patients that are in Mulago right now who have alcohol dependency have liver cancer as a result of alcohol consumption. So cancer generally alcohol generally has a very big concordance with alcohol consumption and cancer.
Okay, interesting. Now, Dr. Baluku, let's get back to your profession. As a doctor working in Uganda, how many years, by the way, have you practiced?
5 years.
5 years. Has there been any significant improvement in terms of the services being delivered by the Ministry of Health to the Ugandans? Have you seen any significant improvement?
Well, of course, I'll fault you on how significant is significant, but I'll say yes.
Let's use general.
There will be, yes, there is a significant, especially when it comes to coverage. You see that there are more health facilities being constructed, and that reduces the distance from homesteads from the health facilities. That is a good point. Somebody can at least access a health facility. Whether you'll find the health facility with drugs or with health workers, that's another thing altogether. Yes. Secondly, the other aspect of it is the government is trying to improve remunerations, especially for working in fat-rich areas. And I think that's also another plus for the government.
Thank you so much, Dr. Baluku.
Thank you very much, Samson.
It has been an absolute pleasure having you over the last 2 weeks, and we wish you very, very well.
Pleasure is mine. Pleasure is mine.
In your career growth, and hopefully the next time you come back, you will be Director of Medical Services.
That'll be interesting. Thank you, Samson.
You're welcome. For those of you watching at home, that has been Dr. Baluku. Dr. Baluku is an internal medicine doctor, and that's where he wants to specialize. Probably his PhD will be rolling very, very soon if the government or some other donor gives that money for him to study. And thank you so much for those who have been behind the camera, led by a wonderful David here and a certain Ivan somewhere there, dealing with making sure that the nitty-gritty is all right. Until next time, when I have another guest under scrutiny, it is bye-bye for now.